Hi there. My name is Michael, and I am a pharmacist board certified in psychiatry and pharmacotherapy. And today, we're going to talk about a topic that affects many people: panic attacks. If you've ever experienced one, you know how overwhelming and scary they can be. But the good news is that there are ways to understand what's happening to your body and mind during a panic attack, and more importantly, how to manage and prevent them. If you're new here, don't forget to subscribe and hit the notification bell for more mental health tips and strategies. First, let's talk about what a panic attack is. A panic attack is a sudden episode of intense fear or discomfort that reaches a peak within minutes. During a panic attack, your body goes into fight or flight mode, even though there's no real danger present. This response is your body's way of protecting you, but during a panic attack, it's activated when it's not needed. Common symptoms of a panic attack include things like a racing heart or palpitations, shortness of breath or feeling of being smothered, chest pain or discomfort, dizziness or lightheadedness, sweating or chills, nausea or stomach pain, feelings of unreality or detachment from oneself, fear of losing control or going crazy, and fear of dying. These symptoms can be incredibly frightening, especially if you're experiencing them for the first time. It's important to remember that while they're uncomfortable, they're not dangerous. Understanding what's happening in your body can help you feel more in control. During a panic attack, your body is flooded with adrenaline, which is why you might feel shaky, dizzy, or have a rapid heartbeat. Your breathing might become faster and shallower as your body tries to get more oxygen. These are all normal responses to what your body perceives as a threat, even though there's no actual danger. Now let's talk about how to manage a panic attack when it happens. The first step is to remind yourself that what you're experiencing is a panic attack and that it will pass. It might feel like it will last forever, but panic attacks typically peak within 10 minutes and then gradually subside. One of the most effective ways to manage a panic attack is through deep breathing. When you're in the middle of a panic attack, your breathing can become shallow and rapid, which can make your symptoms worse. Try this simple breathing exercise. Breathe in slowly through your nose for a count of 4, hold your breath for a count of 4, and then exhale slowly through your mouth for a count of 4. Repeat this until you start to feel calmer. Deep breathing helps to activate your parasympathetic nervous system, which calms your body down. Another helpful technique is grounding. Grounding exercises help bring your focus away from the symptoms of your panic attack and back to the present moment. One effective grounding technique is the 5-4-3-2-1 method. Identify 5 things you can see around you. Identify 4 things you can touch. Identify 3 things you can hear. Identify 2 things you can smell. And identify 1 thing you can taste, or focus on your breathing. Grounding helps you reconnect with your surroundings and reduces the feeling of being overwhelmed. You can also try holding an ice cube or splashing cold water on your face. The sudden cold sensation can help interrupt your panic attack and bring your focus back to your physical surroundings. After the panic attack subsides, it's important to take care of yourself. Give yourself time to rest and recover. Reflect on what might have triggered the panic attack and consider talking to a mental health professional about your experiences. Therapy, particularly cognitive behavioral therapy or CBT, can be incredibly effective in helping you understand and manage panic attacks. Now let's discuss prevention. While it's not always possible to prevent panic attacks, there are steps you can take to reduce their frequency and intensity. Regular exercise, a healthy diet, and adequate sleep can all help regulate your body's stress response. Mindfulness and relaxation techniques, such as meditation or yoga, can also help you stay calm and centered. Learning to recognize your personal triggers is another key step. Triggers can be different for everyone, but common ones include stress, caffeine, alcohol, and certain environments. By identifying and managing your triggers, you can reduce the likelihood of a panic attack. Now let's talk about another important aspect of managing and preventing panic attacks: nutritional supplements. While supplements are not a cure for panic attacks, certain nutrients can support your nervous system and help reduce the frequency and intensity of these episodes. One of the most commonly recommended supplements for anxiety and panic attacks is magnesium. Magnesium plays a crucial role in regulating the nervous system, and a deficiency in this mineral can lead to increased anxiety and stress. Magnesium supplements, particularly in the form of magnesium glycinate or magnesium citrate, can help calm the nervous system and support relaxation. You can also boost your magnesium levels by incorporating magnesium-rich foods into your diet, such as leafy greens, nuts, seeds, and whole grains. Another supplement to consider is L-Theanine, an amino acid found naturally in green tea. L-Theanine promotes relaxation without causing drowsiness and can help reduce the physical symptoms of anxiety, such as a racing heart. It's available as a supplement and can be taken on its own or combined with other calming supplements. Omega-3 fatty acids are also worth mentioning. Found in fish oil and flaxseed oil, omega-3s have anti-inflammatory properties and are known to support brain health. Research suggests that omega-3 supplements can help reduce anxiety symptoms and improve mood, making them a valuable addition to your mental health regimen. Finally, consider B-complex vitamins. The B vitamins, particularly B6, B12, and folic acid, are essential for a healthy nervous system. They help regulate neurotransmitters like serotonin and dopamine, which play a key role in mood regulation. A B-complex supplement can help ensure you're getting enough of these important vitamins, especially if you're dealing with high levels of stress or anxiety. Before adding any supplements to your routine, it's important to consult with your healthcare provider to ensure they're safe and appropriate for you. Everyone's body is different, and what works for one person may not work for another. I also want to talk about an important aspect of managing panic attacks: medication. While the coping strategies, lifestyle changes, and supplements we've discussed are incredibly valuable, they might not be enough for everyone. For some people, panic attacks can be so severe and frequent that medication becomes a necessary part of treatment. Medications such as selective serotonin reuptake inhibitors, or SSRIs, benzodiazepines, or beta blockers are sometimes prescribed to help manage panic attacks. These medications can be very effective in reducing the frequency and intensity of panic attacks, especially in the short term or during particularly difficult periods. However, as a pharmacist, I believe medication should be considered a last resort. It's crucial to develop and rely on coping skills such as those we've discussed today, because they provide you with tools that empower you to manage panic attacks in the long term. Coping skills help you build resilience, regain control, and reduce dependence on medication over time. If you're considering medication, it's important to have an open and honest discussion with your healthcare provider. They can help you weigh the benefits and potential risks and guide you towards the best treatment plan for your individual needs. Remember, medication can be a helpful tool, but it's equally important to focus on building and practicing those coping strategies that can provide lasting relief and empower you to take control of your mental health. Panic attacks can be challenging, but with the right tools and support, they can be managed. Remember, you're not alone, and help is available. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more mental health and wellness content. Also, remember I have many videos on this channel about anxiety and other mental health problems that can help you. My name is Pharmacist Michael. Be happy and be healthy.